All right, so this is a conventional two-dimensional x-ray, and it gives you a decent amount of information, and it used to be the standard of care. And in this area, you can see that this person's tooth had a root canal. You can see part of the sinus. You can see the canals that are filled. And you may be able to even see a slight infection or residual infection at the tip of this root. But the biggest problem we've had with this patient is that he is in excruciating pain, and based on this x-ray, you would think he really shouldn't have that much pain. I pressed on the sinuses. He is very tender in that area. So we then decided to take a cone beam computer tomography or a 3D x-ray, digital CAT scan, and I'm going to show you what this tooth looks like on the CAT scan. So there it is, localized, and as you can see, as we move in and out, you can see on the buccal part where the two roots are right here, you can see a decent amount of infection. And as we continue towards the palate, you can still see the infection here down the buccal. And as we get towards the palatal root, you can see how bad this infection really is and was, to the point where it makes perfect sense as to why he was in so much pain. We can look at it from a different angle, and again, you can see the root canal fill, but more importantly, you can see the amount of infection that is in this tooth or at the apex of this tooth. Again, here, infection, infection. So based on this x-ray, it's not a surprise that this patient was in as much pain as he was. But if we look at the original x-ray that we took, you would think he really should not have a whole lot of issues. So again, this is the reason why today I believe that this is the standard of care. You need to take these cone beam 3D x-rays on every patient who has, in my opinion, every patient who comes in, just to make sure that everything is looked at properly. Good.